So, good evening everybody. I am Dr. Aravind Jagadeesh, Chief Diabetologist at Dr. Aravinda Diabetes Center from Bangalore. Today I had my talk in BPCON 2022 in Lucknow. My topic was on ARB's usage in the management of diabetes hypertension. So we know hypertension is very rampant in our country. Nearly 35% of our population are having hypertension. In the same way, we know diabetic prevalence is also very high in our country. That is the reason we are the second in position when it comes to world population of diabetes. The question comes when you are using the hypertensive drug in a diabetic patients. So the RAS inhibitors, that is AC inhibitors and ARBs plays an important role in the management of diabetic hypertension. The important things we should always remember when it comes to the normal blood pressure, it is we always take should be less than 140/90. But when it comes to diabetic patient, we are more stringent in getting the blood pressure to less than 130/85. So in this context, which drug to use in the diabetic patients, if you take, it should be the AC inhibitors and ARBs. So ARBs, yes, one of the drugs that is we know it is so many sartans are there, telmisartan, olmesartan, valsartan, losartan, all those things are there. The most commonly used in our country is telmisartan and olmesartan. So to that extent, we have got sufficient data when it comes to prevention of heart failure or in person with post MI. In all these conditions, ARB has a role to play. So we give ARB as a first line drugs in a diabetic hypertension patient. So AC inhibitors and ARB always a debatable thing. So the data is there for both. Even the AC inhibitors have got a sufficient data and ARBs is also has got a sufficient data. When it comes to AC inhibitor, the only thing we should be careful, we should be aware, and all of us should be aware, is the question of side effects, that is the dry cough. That is the only side effect, major side effect. Otherwise the rest all is common, like angioedema can occur in both and all those, and hyperkalemia can occur in both. So you should use AC inhibitor or ARB. When your patient is having a dry cough, you can consider angiotensin receptor blocker as the drug of choice. But always remember, never use AC inhibitors and ARBs together. The recommendation is not there to use AC inhibitors and ARB together because of a very strong incidence of hyperkalemia and side effects related to that. So the main take home message from my talk today in BPCON 2022 is the use of ARBs in a diabetic hypertensive patient is very helpful in preventing the major incidences of heart related events and renal related events. Thank you.